for March 17th, 2020. If all members, please could press their attend buttons and silence any cell phones. First item on the agenda is the Pledge of Allegiance, followed by the invocation. If you could please all rise and face the flag. Join me.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And now the invocation by Supervisor Locke.
Bless this meeting place. May peace and kindly deeds be found. May gratitude and love abound. And we hope and pray that this coronavirus soon goes away. Happy St. Patrick's Day. Amen.
Thank you, Supervisor Locke. Moving on to the next item on the agenda, and that's adoption of this evening's agenda. And for that, I will call on Supervisor Ulrich.
I move to adopt this evening's agenda.
There's a motion and a second to adopt this evening's agenda. And just for clarity, I wanted to make sure everyone is aware that the District Attorney Capital Project will not be on the agenda this evening. Director Mike Elder is aware of that, and the District Attorney is all aware of that and understand as well. So with that, there was a motion and a second. All those in favor say aye.
Aye.
Opposed? Motion carries unanimously. Moving on to the next item. That's the time in every meeting we allow an opportunity for anyone from the public to speak on any item on this evening's agenda or anything under county jurisdiction. Is there anyone who wishes to speak this evening? Is there anyone who wishes to speak? I'll say one last time, is there anyone who wishes to speak this evening? All right, I'll go ahead and close that portion of the agenda, and we'll move on to the next item, and that's correspondence. For that, I'll call on Clerk Ertmer.
Thank you. Before we do the correspondence, you'll see on your desk tonight, Julie passed out the WCA survey. They do that every year. Or I guess every 2 years, sorry. So when you get that completed, if you can just return it to me either tonight or put it in the mail, and I'll turn them all back in together to the WCA. Correspondence tonight, we have a couple of notices of claim, 3 actually. One from General Insurance on behalf of Jeffrey Long for damage to his vehicle caused by an accident with a snowplow, referred to Personnel and Finance. A notice of claim from attorney George Curtis on behalf of Mary Jo M. Schrader for injuries sustained in a fall at the Sheriff's Office back in February of 2019, also referred to Personnel and Finance. And a notice of claim from Progressive Artisan and Truckers Casualty Company as subrogee for Alexander Hussein for damage to his vehicle back on January 13th of 2020, also referred to Personnel and Finance. 3 petitions for zoning amendment, one from Ed Kerr, Town of Wolf River, Scott Anderson, Town of Omro, and Terry E. Coates, Town of Omro. Those are all referred to planning and zoning. And then Outagamie has 2 resolutions, one supporting legislation regarding hearing timelines for children in need of protection proceedings and juvenile delinquency cases, and the other is approving pending legislation, Commitment to Veteran Support and Outreach Act. And those are referred to legislative. And that's all.
Thank you, Clerk Ertmer. Moving on to the next item on the agenda, that's reports from committees, commissions, and boards. Any reports from committees, commissions, and boards? I see a couple. First, I'll call on Supervisor Wojciechowski, followed by Supervisor Eisen.
Thank you, Mr. Chairman. The IS committee has submitted 2 letters of recommendation addressed to specifically the chairman of the board, but we felt we wanted all members of the board to have it just so they could read and see what we were doing. As some of you may remember, a couple months ago we presented a resolution specific to the way in which we vote. It was our hopes to help utilize iPads more to vote. But we realized after talking, because it was sent back to committee and in discussions, given that the lack of time we had as a committee and just kind of, feedback from other members, we thought that it would be better just to put a recommendation forth as opposed to a resolution, because these changes can be made without a resolution by the chairman or chairperson of the board. So we thought we would just put our recommendation. I'm not going to read them out loud. You can read them yourselves, but one is specifically, again, to update the technology that we use for voting, not change the method of voting, but just the way in which we do vote. The other one has to do with establishing a technology replacement plan for county board electronic devices. So our iPads, having something in place for future boards to look at and decide what we need to do, so we're not kind of just scrambling when the budget time comes. These are recommendations. They're obviously not binding, but our hope is that the future county board chairperson or any individual will come forward, see this and say, hey, maybe we should take them up on this recommendation and do something. So that's our hope with that. If you have any questions about it, I'd be happy to answer, but they're just recommendations, and I hope each of you will take the time to read them and consider them for future board meetings. Something else I wanted to mention, I know me and some other supervisors had been working on a resolution having to do with the Hmong community that won't be on this meeting's agenda, but I'm asking that the chair of the legislative committee please try to hold a meeting as soon as possible so that resolution can be voted on and sent to the full board, just so we don't have to delay action on it. Finally, the last thing I want to say is, as many of you know, this is my final county board meeting, and I just wanted to say thank you, everyone, for these last 4 years. I was first elected at 19, and now I'm 23, graduated, so I kind of grew up a lot on this board, so I just wanted to thank everyone for a great 4 years. Thank you.
Thank you, Supervisor Wojciechowski. Certainly indeed wonderful to have you on the board as well. Wish you all the best. Next speaker is Supervisor Eisen, followed by Supervisor Wingren.
Coincidentally, I have 3 reports, but I would like to address Supervisor Wachowski's IS recommendations. And the recommendation might be to refer that to the Judiciary Committee to consider that to put in the rules. That's where it belongs. But I have a email that I would like to share with you from Linda Coleman, Director of Emergency Management, in the light of the pandemic which we are experiencing. As you know, this is a public health lead response. We are here to assist with any requests the health department has. We have met with the county executive and others from his team to discuss many issues that could impact employees and continuity of operations. His team is working on addressing all questions employees have. I am confident that a COG plan each department had in place will assist in continuing government operations. We have fielded questions from the public and businesses and assisted when we could, or helped them in get in contact with the right person at the health department. We have shared a lot of information that the health department has provided to us on our social media. I am in daily contact with Doug Gearin and his staff. My staff has assisted the City of Oshkosh leadership team with Wisconsin Emergency Management's virtual EOC. I'm in daily contact with Chief Stanley from Oshkosh Fire EMS with questions or requests he has. The sheriff and I are communicating daily about the virus as well. And that's from Linda Coleman, Director of Emergency Management Department. I'd also like to share with the board an email I received from Eric Fowle, the Executive Director of East Central Wisconsin Planning Commission. Dear friend of East Central RPC, I'm writing to inform you that as the end of February, I will no longer be employed by the commission. It was an honor to work for this progressive agency for 23 years, and I've appreciated every minute of working with so many great communities, state, federal agencies, and nonprofits, businesses, individuals, as well as our own dedicated and passionate staff. If you have any questions or needs of the commission in the short term, please do not hesitate to contact the office to speak to our staff. And more information about changes in the administrative leadership will be announced in the coming weeks and months. And the last thing I'd like to share is that as a secretary of the Solid Waste Management Board, the meeting for Wednesday, 9 o'clock, has been canceled.
Thank you, Supervisor Eisen. Next speaker is Supervisor Wingren, followed by Supervisor Lautenschlager.
Thank you, Mr. Chairman. First of all, personal thing, I'd like to thank you for putting up with my persistent questions all week about the status of this meeting, and to thank you and the staff responsible for wiping down this room. I imagine that's Mike and his staff, so thank you. For all of you who went out of your way to make sure this is a safe meeting, that your government works. Thanks especially to Doug Gearin, who's been all over the place. I don't know, does he ever sleep? On Facebook and other social media to alert the public, and I think education is the best thing we have right now to calm the fears and the rash hysteria that seems to be prevalent in many areas. And Parkview staff, who are constantly working probably many, many overtime hours to make sure that our frail elderly are cared for. Thank you, one and all. This is the last meeting of the board. I think we'd be remiss if we did not also thank two other members who this is their last meeting, Harold and Larry Smith. They've been invaluable members of the board for many years, and I salute them for their efforts and the passion which they bring to this, have brought to this effort. Finally, since this is the last meeting of this session, the next meeting in April is our organizational meeting. To prepare for that meeting, the next meeting of the Judiciary Committee in April will take up any rule change suggestions you have. It's the Judiciary Committee's responsibility and obligation to bring the package of rules to the organizational meeting with any changes that have been suggested by the membership. So if you have any changes to the board rules that you wish to have brought forward to the body, please get them to me or a member of the county clerk's office before our April meeting, and get them in writing, please, to me, and be as specific as you can. Thank you.
Thank you, Supervisor Wingren, and thank you for the comments. Next speaker is Supervisor Lautenschlager, followed by Vice Chairperson Egan.
Thank you, Mr. Chair. I was fortunate to attend the NACO Legislative Conference along with Supervisor Schneider and Supervisor Warnke in Washington, D.C. on February 28th to March 4th. At this conference, some of the guest speakers were Ben Carson, HUD Secretary, David Bernhardt, the Interior Secretary, General Colin Powell, and President Trump. I attended my NACO Steering Committee, which is the Human Services and Education, on Saturday, February 29th, from 9 a.m. to 4:30 p.m. We were briefed by DHS secretaries about some of the action up at Capitol Hill, temporary assistance for needy families, supplemental nutrition assistance program, and support the local services block grant, and support the community service block grant. We also talked about some resolutions that we are supporting and bringing up in the July NACO annual convention in Orlando, Florida. On Monday, I attended the NACO Central Region Caucus, where we had a presentation from the co-founder and chairman of the Professional Development Academy that also General Colin Powell helped create, which is an online scholarship program which our county belongs to. And I was just told today, I got a call from them today, that the one person that we have from our county that's participating in it is participating in the IT security. That's a $1,000 scholarship. But anybody else that's interested, they also give, our county is also eligible for 3 or 4 $300 scholarships that you can use towards this online from the academy. We also heard from the 2 candidates that are running for second vice chair of the of NACO, Cindy Bobbitt from Oklahoma and Denise Winfrey from Illinois. And then on Tuesday, WCA and WIS Politics held their breakfast caucus, and we had Representative Mike Gallagher and Representative Mark Polkan spoke to us on their views and at the Capitol and what needs to happen to get some of the bills passed that haven't got passed in this last year or so. Representative Gallagher and Polkan have worked together jointly on several bills. The WCA representatives, then after that, we went up to the Hill to talk to our legislators about some WCA issues. The 3 that we talked about were support for county priorities in a federal infrastructure package, pre-trial detainee health care, and the CVSO grant funding for the VA. We also had a lot of workshops and presentations on the, and several on the coronavirus. Thank you.
Thank you, Supervisor Lautenschlager. Next speaker, Vice Chairperson Egan, followed by Supervisor Defferting.
Thank you, Mr. Chairman. I'd just like to apologize to the 2 or 3 of you that I said that we would have legislative this month. I pulled it because of what's going on not only in our country and our state, but also in our own county now. Those of you, Aaron in particular, that won't be here, whomever the new chairman is, I'll make sure and let them know so you know what date it is or whatever, and they can go ahead and let you know so you can come and speak on the one that you wanted, and you other ones, hopefully you're still on there. Thank you.
Thank you, Vice Chairman Egan. Next speaker, Supervisor Defferting, followed by Supervisor Powers.
Thank you, Mr. Chair. First off, I want to commend the Winnebago County Health Department for their constant correspondence and communication in regards to what's going on right now. I have been getting a lot of questions from people in my county and in the city of Neenah about this, and because of them, I'm able to provide them with the information that they need. So hats off to them. They're being heroes right now. I'm sure they're working around the clock, and it's a very stressful time. I wanted to update everyone in regards to the current diversion program that's in the basement of the Orrin King building. It turns out that that wall that's in the basement is cinder block and is likely load bearing, and so now we're at a point of limbo. The architects need to figure out what to do. We may have to put in a large picture window and a door, but we can't knock out that wall entirely. So I know that right now the architects are kind of scratching their heads and figuring out what's next. Hopefully we'll figure out a resolution soon. Soon, I'm meaning next month. The rest of the diversion program right now is happening. Carol Morak, who is the first case manager, has been receiving referrals from the district attorney's office. They're currently they do have room available in the basement of the Orrin King building, but right now that's because of what's going on. They're not. I don't think they're fully set up yet, but they are mobile. They're just basically using a room that's whatever room's available. And the DA has been setting up meetings with the Oshkosh Boys and Girls Club in regards to children that are involved with parents who are addicted to opioids or somehow involved in the criminal justice system. So there's the beginning steps of that is happening. And I know that there's going to be another meeting set up with Reach Counseling in Neenah, too, to figure out a way for Reach to be involved those who are involved with trauma and PTSD cases in Winnebago County. So I wanted to have the county board be aware of that at least the gears are turning there. Thank you.
Thank you, Supervisor Defferting. Next speaker, Supervisor Powers, followed by Supervisor Gabbard.
Thank you, Mr. Chairman. We had a chance to thank Supervisor Wojciechowski for his service, and we didn't really, because it kind of got sandwiched in, to thank Supervisor Harold Singstock and Larry Smith. So I'd like to take that time to do that now. Thank you.
Thank you very much. Next speaker, Supervisor Gabbard.
One quick thing, as this board sits tonight, I want to thank everyone for supporting the airport general aviation project that we've had been going on for years and years, and especially this board for voting approval of the project. As it stands right now, the project is going out for bids on March 30th, I should say, and will be bid April 23rd. So we're moving ahead slowly but surely, and we are also in the process of moving Basler out of the west wing into the terminal building. We're going to do a little remodeling, which was included in our dollars that you folks all approved for us. So we'll get them moved over so that when the bids are let, the contract signed, we can start some demo on that west wing. So again, thank you everybody on this board. Appreciate it.
Thank you, Supervisor Gabbard. Next speaker, Supervisor Norton.
Thank you, Mr. Chairman. I have a quick question. Through this crisis until it ends, is it up to the committee chairman whether or not that committee meets in the future, or any guidelines we're supposed to have? That's my general question.
You answered the question. It's up to each individual committee chairperson at this point in time.
I guess I didn't hear the whole question.
His question was in regards to committees and in terms of whether they would be held or not. And he had mentioned and wondered, and he's accurate at this point, it's up to the committee chairperson as to whether or not they would have the meeting or not.
I'd like to follow up. I was going to ask the county executive later. I am presuming that all county government buildings will stay open unless it gets really dire. And obviously I'm asking that because we're supposed to have our meetings in a county government building. That's why. Mm-hmm. Okay.
Yep. I'm sure the county executive will be happy to answer that question, as he understands it for the moment anyways, up next with his executive's report. So thank you, Supervisor Norton. All right, and before the county executive report, we have one other item. That's the approval of the meeting proceedings from February 11th, 2020. Is there a motion? There's a motion and a second. Any discussion in regards to the minutes from February 11th, 2020? Any changes, adjustments? Seeing none, we'll do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. Moving on to the next item, and that's county executive's report and county executive's appointments. Executive Harris?
You're going to have a COVID-19 presentation as part of this meeting, so I won't spend any significant time addressing it, except to say that the environment is changing very rapidly. Yesterday, we received an order limiting participation in meetings to 50 people. We were monitoring the number of people that were here at this meeting and had an overflow room available if necessary. We are below 50 people. But an emergency order number 5 came out, I think about 3 o'clock today, cutting the numbers to 10. But it did have a number of exceptions to it, including government facilities and meetings. So we do fall under an exception. The fact that we are holding the board meeting is not because we don't take this serious. We take this very serious. But because if the county needs to react to the situation, we have to continue to have board support to have that occur effectively. So I just wanted to mention that, and you can get more information when you get the presentation. It's been my custom to point out one or more items on the agenda that I think are worth special attention. There's Resolution 298-03-2020, and that's adopting a new general fund balance policy. I want to thank Vicki Fitzgerald for her work on this, as well as considerable support given from Harold Singstock on formulating that policy and making it consistent with other counties. And I think their policies in many ways formalizes what we've already been doing, but I think it's good to have it in a formal policy that's been researched and compared with other counties. So I'm glad to see that come forward. And then, Mike, you asked a question, I'm not sure if I've addressed it.
Oh, I have a question, but I'll wait till you're done, Mark.
Okay. Well, I'm going to move on to appointments. So do you want to do that now, or do you want to wait?
I'll wait till after.
Okay.
Okay, very good. Please go ahead to appointments.
I've got a appointment for the balance of the term of Ken Roble on the East Central Regional Planning Commission. And that just goes through April 30th, 2020, of Robert Keller.
There's a motion and a second for the temporary appointment for Supervisor Keller. Is there any discussion? We'll do a voice vote. All those in favor say aye.
Aye.
Opposed? Motion carries unanimously.
And then the next item is an appointment for a full term that would follow the short term till the end of April, that would run to April 30th, 2022.
There's a motion and a second to approve the appointment for Supervisor Keller through April 30th, 2022. All those in favor say aye. Aye. Opposed? Motion carries unanimously.
I have an appointment to the balance of the term, unexpired term of Jerry Finch to the Solid Waste Management Board, and that's Thomas Borchardt. Jerry Finch has resigned from that position.
Is there a motion? There's a motion and a second to approve the temporary appointment to Supervisor Borchardt. All those in favor say aye. Aye. Opposed? Motion carries unanimously.
And then an appointment for a full term to follow the shorting implement we did, and that's for a 3-year period ending April 18th, 2023.
All right. There's a motion and a second to approve the appointment of Supervisor Borchardt through April 18th, 2023. We'll do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously.
And then I would accept any questions.
Absolutely. Supervisor Norton?
Thank you, Mr. Chairman. Mark, this afternoon I listened on a conference call with the NACO that had to do with the coronavirus, and I learned then that the Family First Coronavirus Response Bill was passed, but they tweaked it, and maybe Mike Collar knows it. They tweaked it in that I think they exempted local governments or governments from the extension of the changes in the Family and Medical Leave Act. What my question is, do we have any contingencies if this thing lasts, God forbid, June or July? Have you planned on contingencies what that happens to help our employees? That's my first question. My second question, if you want, I guess I can wait till the coronavirus, but at one point, like Mark, you know as well as I, the city of Oshkosh is pretty much shut down. And at what point do you ask your department heads to find ways that you can limit the interaction, the human face-to-face interaction? That's my two questions. Contingency plan for employees if this crisis goes more than 30 days or more, and two, at what point, or have we ever thought about minimizing that face-to-face contact we're supposed to have?
Yeah, actually, you're right on target on both those items. With regard to special measures to help the employees, we were in serious discussions about the possibility of adding additional sick time in a separate category that would apply only to the COVID-19 virus. We suspended that because of the federal legislation you just mentioned would add an additional 2 weeks of sick time, and we needed to wait to see what the final form of that bill is, because they're adding that on top of whatever you have, and if we adopted 2 weeks and then that passed, that would take us to 4 additional weeks, and that's not our intent. On the other item, face-to-face contact, actually I issued a memo the other day, maybe earlier this week actually, and or maybe it was last week. It's all running together because it's changing so rapidly. But recommending that people limit face-to-face contacts in the meetings they attend, and we are getting some changes in the state rules that are helping us out with that. For instance, there's been some changes where we don't have to have face-to-face meetings with WIC clients to provide benefits. That's a new change. We are looking at ways we can have less face-to-face contact while still providing the services we provide. And then the question comes up, some counties are talking about only keeping essential county workers. You know, there's not many county workers that aren't. You know, the obvious ones is the sheriff deputies and the jailers, you have to keep them on. The nature of their jobs, they can't work from home or have significant changes. Parkview Nursing Home, you know, they have to have the CNAs and the nursing staff and all the support staff present. There's no way to cut back on that. Many human service workers are involved in essential services for the public that may be under real stress because of the loss of hourly work resulting from this virus. And even other things like the clerk's office issues marriage licenses. If this is a prolonged period of time, we couldn't possibly shut off access to marriage license for that period of time. Families that lose a family member need access to death certificates in the Register of Deeds office. So there's so many of the functions that have to continue. Our focus is going to be on how we can continue to provide the county services while still trying to limit face-to-face contact with the public that may pose a risk to our workers. So it's a real balancing act.
Thank you. Thank you, Supervisor Norton, for your question. I believe we have a question from Supervisor Bender? No? Please, go ahead, Supervisor Bender.
I know we had an employee from Winnebago County that went to the Three Waves Clinic and wanted to be tested. He had a fever, and they have no testing kits. Do you know when they will be available to test? I mean, we got a high deductible, and a lot of people that work for us, they don't want to spend $250 for an office call to go to the doctor. You know, they go to that Three Waves Clinic, and they would like to be tested there where there's no cost. You know, I mean, he had a fever, he had basically some of the symptoms, and they have no tests. I guess we need to address that.
That raises two issues. One is with regard to deductibles and co-pays. And it's our intent to modify the policies to allow employees to get their tests free of charge. But the other question it begs, under what circumstances are physicians allowed to do that testing? Last Wednesday, they broadened the policy, and prior to that, you had to have a travel to a hotspot or direct contact with a confirmed case. They then said that doctors could order tests wherever they felt it was needed, but I am hearing some feedback in the community that there may be still some limitations on the tests that are actually being done. But Mike Collard's in the back. I think he wanted to address part of this.
Please go right ahead, Director Collard.
Thank you. Just specifically with respect to the Three Waves Clinic, I checked with them yesterday afternoon, and they now have a limited, very small but limited, but there is a supply of testing kits at the clinic that they can use in appropriate circumstances. They're just kind of being careful with when and how they use them now. The other issue at the clinic we're looking into is the possibility of telemedicine. A lot of medical clinics now are reluctant to have people even come in, but if you can look over the phone or through a Skype, that can protect people from transmitting through the medical facilities and ease the burden on the traffic through the clinic as well. There is an extra cost to that, but we're in discussions with them right now about adding a telemedicine capability to the clinic as well, which should help a little bit.
The other issue is even if you have the swabs to gather the samples, the lab work is done either in Milwaukee or in Madison, but they have got a fairly short turnaround time now of about 3 days. And it's clear that the number of tests being conducted in the state are ratcheting up very rapidly, but we're actually at a very low level prior to this week.
Thank you for your question, Supervisor Bender. I also see Supervisor Locke. You have a question?
I was just curious, if I ever had to be tested, would I have to come all the way to Oshkosh, or could I go to Appleton? I live in Appleton.
Well, the health department, when they do their presentation, could correct me if I'm wrong, but I believe you could go to your own doctor in Appleton, but they're suggesting that you call ahead, because if someone wants to be tested, they probably have suspicion that they have it. They're not going to want you to come into the doctor's office or into the emergency room. They're going to probably make arrangements to get the tests.
Thank you, Supervisor
What kind
Locke.
of arrangements?
Well, they're not going to want someone who thinks they have that virus to come into a crowded waiting room. They probably would gather them from you outside the location, or make special arrangements to gather them at after hours.
Thank you.
Thank you, Supervisor Locke. Next speaker, Supervisor Albrecht.
I recently had a major procedure done, and they were supposed to follow up Monday and do the second procedure because the test that showed positive, and then they called me today and told me that they would call me at a later date.
They're being overwhelmed, and anything they consider elective, they're rescheduling. And some pretty serious stuff is being rescheduled because the system's starting to be overwhelmed over this virus.
That is correct. Thank you, Supervisor Albrecht. Seeing no other call-ins, we'll conclude. Thank you, Executive Harris.
Thank you.
Okay, moving on to the next item, and that's County Board Chairman's report. So first, a few announcements, then just a couple quick thoughts for you all. So first of all, just to keep on your calendars, even though we recognize these dates now are all tentative, when we recognize that. But May 18th is still our tentative date for the County Board Tour. That's a Monday, right before our business meeting in May. Once again, as we move through this situation, we'll update you as to whether that date would have to change, of course. Likewise, similarly, I believe it was Supervisor Wingren who referred to the organizational meeting. Tentatively, it's scheduled for April 21st. Please understand that as the situation evolves, we may have to change that. We'll just adjust as we go along and work through this situation. But for the present time, it's as of Tuesday, April 21st. Tuesday, April 21st. I also want to let you, in case some of you do not know, one of our former supervisors, longstanding former supervisors, passed away in February. On February 15th, Supervisor James Lawson II passed away. For those of you who have been on this board for a long time, he was a long-standing member of this board for 25 years, actually. And his last year with the board was back in 2007, so I certainly remember working with him because I started in 2006. And he was a long-standing chairman of the Parks Committee as well. So certainly unfortunate news to hear, but I wanted to pass that along for folks if you weren't aware. And then I also, too, wanted to thank, I know a number of you have thanked, but the three supervisors who will be finishing up with them, it is indeed their last meeting. Supervisor Wojciechowski, who was elected in 2016, so thank you for your 4 years of service. Supervisor Singstock, who was actually originally appointed in 2011, and then been elected ever since. Thank you, Supervisor Singstock, as well for your 9 years of service with us. And then, of course, Supervisor Larry Smith as well, who was elected in 2008. So been with me pretty much the whole time I've been on this board. So thank you as well, Supervisor Smith, for your service on this board. So if we could give one more final round of applause for all three of those individuals. Truly appreciate working with you. Now, just wanted a real few comments, and I'm not going to be long because part of the things that we did were actually to keep the meeting a little bit shorter, but they still bear commenting just a little bit. There's a lot of discussion on whether to have this meeting or not, and a good, robust discussion. Frankly, it was not an easy decision. As the county executive mentioned, so much of our guidance has evolved, frankly, daily. The CDC just over the weekend said gatherings of 50 or more. And in still some ways, that is part of a guidance, but as you all know, and there was guidance from our president yesterday in regards to encouraging 10 individuals. And then today, more specifically, by our governor in regards to 10 individuals. That's actually officially started 1 hour before this meeting today. But as the county executive said, there are some exceptions that were put in place, and this type of body is one of those exceptions. However, we did try to do the things we thought we could do to try to reduce the number of individuals we thought we would be at the meeting, as well as reduce the time. So that's why the presentation for the DA's project was actually delayed, and both directors who were involved with that project were made aware of that, simply to reduce the number of folks potentially in the room and reduce the time of the meeting. As Supervisor Wingren said, we did ask and greatly appreciate that facilities did wipe down the room before the meeting, as well as ensured that there was hand sanitizer at the door for you to have an opportunity to gel in and gel out when you leave the facility. So I want to say thank you to those individuals who assisted. Facilities, I know, assisted. I know the Corporations Council's office assisted in a number of ways in terms of advice. The county clerk's office assisted in so many ways, greatly appreciated. And our county health department, as a number of you have mentioned, have been so integrally involved with this, and their communications have been outstanding. And if there's anyone in this room, because I don't know who gets those updates, I'm not sure, it might be all of you, but if for some reason you aren't, please reach out so that you can get those, because they're certainly wonderful and much needed. And then just one last final comment, kind of about our situation. You know, there's been a lot of talk about the term social distancing. And I guess I would argue that perhaps that wording could have been done a little differently. Because really, it's about the physical space. That's why we talk about the gathering. That's why there's the discussions about the 6-foot distance. It's really about physical distancing. And I would argue that at this point in time, we need to stay socially connected more than ever. We've been talking about social connectedness actually for the last year or two. It's a buzzword that we've been promoting. Our health department has been promoting this concept of social connectedness. So while I recognize we have to take some measures to be a little more physically distant to help slow the spread of this, we need to be socially connected more than ever. You know, I've lamented over the years sometimes Facebook and, you know, Snapchat and Twitter and all these things because, you know, I have to be kind of pulled kicking and screaming on some of that stuff, admittedly, like all of us in some ways. But I would argue that now's the time more than ever to utilize these tools, to stay socially connected. We really need to stay connected in our mindset and our own common purpose. So I just put out there that maybe physical distancing is really the term. Socially, we need to stay more connected than ever, and I'd urge you to do that. And the only other final point I would say is, you know, because I see this as I was going about over the weekend, it's about physical distancing. That doesn't mean you can't be outside. We all need to be outside. We need to be in the environment. We need to be able to go for a walk. We need to be able to go in for nature. These things are more important than ever right now so that we all can maintain our health and, frankly, our psychological well-being. So I encourage you all to get outside, still follow the guidelines, but you can still get outside. You can still be in your yard. You can still hear the birds sing. So I really encourage you all to do that as we continue to move through this situation. So just my kind of final thoughts on the situation. Okay, with that concludes my report. So moving on, once again, the District Attorney Capital Project, we're postponing that for this evening, so we'll move right on down to the COVID-19 update with Kim Goffard, our Communicable Disease Supervisor, Public Health Department. I know also Director Guerin is also in the back. So if you could please step forward, would greatly appreciate it.
Good evening. Most of you, well, you've heard quite a bit here tonight already about the situation. Many of you have already received the situation report for today, which went out at about 6 p.m., so it's probably in your inboxes. It's about our 6th or 7th situation update that we've sent in the past week, and it really is an attempt to try to keep everyone informed as best as possible about all the changes that are rapidly occurring. With me tonight is Kim Gofford, our communicable disease supervisor. Her and her team have been doing an extraordinary job. You know, our role in this situation is one to, you know, rapidly identify people that are infected, rapidly identify people that are contacts to those that are infected, try to restrict their movement, get them treatment, avoid exposure to others to prevent disease transmission in our community. And that's their job all the time. You know, it's much more visible in this situation, but there are many reportable diseases, and this is what they do day in and day out. And until situations like this occur, you just don't hear about it. And so there are hundreds of diseases that are followed up on every year, and this is just a more visible example. So I guess we have Kim and her team that have been working, I don't know how many hours per day, every day, including weekends, so they have not had any time off. We've mobilized additional staff to assist them. We've also mobilized additional staff to assure that we can get out good, credible, timely communications. And so there's quite a few individuals at the health department that are really dedicating all of their time to this, and I really am honored to be here to represent them and have their support in this crisis. So this is when everybody learns about public health, and I'm happy to have them behind me. So quick update, and then Kim's really our technical expert on this, and she can help answer questions. I've got some copies of our latest situation update that I'll have on the bench that you can take on your way out. As of today, big jump in cases, case results from the state, and the announcement that we do have, at least in southeast Wisconsin and in Dane County, community transmission. So in other words, people are becoming infected with disease that we don't know how they became infected. So unlike right now in Winnebago County, where we have 3 cases, we know where they had their contacts, we know how they got disease, and we've worked hard to identify everyone that they could have potentially infected and have them under watch or quarantine. The transmission is occurring now in the community in those areas, and it will likely increase fairly rapidly. That's a corridor that's right on the way to Winnebago County and the rest of the state. We certainly expect spread to occur. So we'll continue to work to identify cases. This is where the social distancing becomes so vitally important. Ideally, we would not have this type of rapid increase in cases, but it's definitely confirmation that there are people spreading disease that probably don't know that they're spreading disease, and by restricting social movements, by restricting gatherings, and urging everyone to stay home, we can reduce spread, and that will accomplish a couple of things. One, that'll hopefully help us from overwhelming our healthcare systems. There are groups of individuals that are highly susceptible to COVID-19, those with more advanced age and those with underlying chronic conditions. They can become very ill, and the numbers or the percentages of the population that can become severely ill could exceed the resources that we have in our medical facilities to treat them, which means not a very good outcome for many individuals if that situation occurs. So the more we can slow the spread down, the more likely we are to treat those people that need it the most, and reduce the overall consequence. That comes at a cost, though. I mean, everybody's feeling the financial impact of this, and it's that balance. How much do we infringe on the rights of people and their movement and their ability to earn a living with the spread of disease that could kill many of our residents. So at this point in time, earlier in the outbreak, it pays to be much more aggressive, because that can have a really big impact over the coming weeks and months. We'll continue to be getting results. We'll continue to issue guidance and test results to keep you updated on this. You've heard about the mass gatherings. That was the big news over the past 2 days. We are internally also, restricting some of our activities. We're reducing traffic coming into our agency, reducing contact. Meetings are virtually all now, through the phone or through video. The community partners are doing an excellent job of canceling meetings and meeting virtually. My plea really is to the individuals now within the community to, heed what is being asked of you in limiting your movement. We're sacrificing a lot right now. Many businesses are suffering. Travel is restricted. There's a tremendous financial consequence to what we're doing. And individuals making decisions about gathering are undermining that. And so we really need to urge individuals to take this very seriously. Young people are less symptomatic and may transmit disease without knowing it. And those are some of the people we really need to reach and encourage to take this very seriously at this point in time. I'll leave that. I'll leave comments at that for right now. Continue to update you with information, and if you have some questions, Kim and I are happy to answer those right now.
We'll open it up for questions. Any questions? I see first Supervisor Eisen.
Thank you, Mr. Chairman. Doug, do you see any precedents for which we model our responses? Episode during my lifetime that comes to mind is the days of the early 50s and the polio epidemic, which hit the streets. And although I was not yet a teenager, I remember some of the restrictions that I had to spend my summers with. Are there models that we can draw on to not only serve going forward, but also getting a perspective of how long will something like this run its course?
So the first part of that's a lot easier than the second part. Anytime we have a novel illness where there isn't, resistance within the community or availability of a vaccine, social distancing for communicable disease is a standard public health practice. And so, that has been studied, and we've had real-world examples. So, the recommendations right now related to social distancing are sound, fully supportive of those. Sometimes we just don't go far enough, and we live in a country that doesn't lock things down like some other countries do, and necessarily be as quite as oppressive in terms of infringement of government on people. And so it's hard in this country sometimes for people to understand and accept that these are critical times. These are times that we're making recommendations that they would probably thought they'd never see. And our biggest danger is not going far enough in the restriction of social movement and person-to-person transmission. All we're trying to do is keep people apart so that they don't spread disease from one person to another. If we can do that long enough, the disease progresses in those individuals that are infected, they recover, and then they don't transmit it to someone else. So that's really, it's simply all we're trying to do is have the disease die out in those that are currently infected before they infect someone else. In terms of time frame, you know, I'm not an infectious disease expert, but you know, I think we're learning as we go. We're learning a lot about this disease as we go. You know, every disease based on the environment that it's in has its own infectivity rate based on, you know, the social situations, the environmental situations, and we need to, you know, understand that well and really learn from others in this case. You know, unfortunately, but fortunately, we have others that have gone before us, and we can take a look at what they've done and learn from what's worked well and what hasn't in those situations.
I would like to commend you for your presence here. I am aware that you ought to have been on spring vacation with your family away from this area, but your presence here is very comforting and very professional to the needs of your constituency and your employer.
Thank you, Supervisor Eisen.
Thank you, Supervisor Eisen. Next speaker, Supervisor Lenz, followed by Supervisor Albrecht.
Thank you, Chairman. I'll try to keep it quick. Right now, I think the communications are good and strong about preventative measures. My fear is that there's a good chance we may be moving into a phase where we need to kind of ease people's nerves and talk through what the process is going to look like if someone does think they got it, and once they've come down with it. So a couple questions I have. Obviously, there's been communications trying to get kits out there and where to go to get tested. After a person's tested, are they then to quarantine themselves at home for X days? Do you know how long that is roughly?
Sure. And forgive me, I have to refer to my notes because everything that we have learned up to this point changed at 5:30 p.m. I don't even know that our chairperson as a physician is aware of these changes in guidance.
Not of the 5:30 ones.
Not of the
I'm aware of
5:30
everything
ones.
before that.
And we've been rushing to make sure that this information gets into the hand of any provider that we possibly could between the time that we were at the health department and here. I think we've heard a lot about patients being denied a test, the test availability, and yes, physicians were given the opportunity to order a test for a patient if they felt that that person met the guidance that was out there at the time for a test for this. What that led to was a lot of testing going on, and some of it was quite necessary, and we try not to second guess what happens at a provider's encounter. But we are seeing the need for some priority testing now at this point. So patients who need to get a test will get a test. Now, what we might see are lower priority tests taking a little bit longer to run than somebody who is critically ill, say, and we need to get that test run right away. So we were updated, like I said, I received this at about 5:30 at night. The State Lab of Hygiene, which is a major laboratory that, as far as I know, the major health care systems are sending their COVID-19 tests there. They have the capability of testing about 400 samples a day. Now, over this weekend, typically they aren't running tests over the weekend, but they did expand and they ran tests on Saturday and on Sunday. The number kept going up. So at this point now, they are asking providers, physicians, physician assistants, NPs, to limit the number of tests, not necessarily because of the testing kits, but because of a lack of reagents. We are seeing a little bit of a backlog on being able to get the proper swabs to do a swab. They have really backed down on the number and type of samples that were taken. They used to have to swab twice in 2 different places, in the nose and in the mouth, and that is no longer the case. So they are suggesting that providers no longer test patients without symptoms and patients with mild upper respiratory symptoms who are not healthcare workers. So there's a set of 4 tiers now that goes through prioritizing patients who are critically ill and in the hospital, all the way down to hospitalized but non-critically ill patients, healthcare workers. There's a whole set of criteria that I won't read to you word for word here. But we are now looking at which test is going into the analyzer first. So that is, what I want to tell you is, I wouldn't say that there's a shortage of tests, but we're getting to that point where if we're not more judicious in the amount of tests that we're doing, we will see a problem. So I can assure you that patients who really need to have a test done, they will have a test done. What may not happen is a patient who wants to have a test done may not have a test done if they do not meet these new guidelines. So it is possible that we will have our providers put in a situation where somebody comes forth with a runny nose and has no other types of symptoms, very mild, doesn't need hospitalization, doesn't need anything extra. They may be sent home just to monitor their symptoms and convalesce at home. So I do want to make you aware of that, and that, like I said, is very new information. Does that help answer?
A little bit of it, but
Okay.
If somebody does get a test because they've checked off enough boxes or whatever it is,
Right.
What should they be doing next? And then the other question I had for you was, if somebody is found with the virus, roughly what's the timeline that they should remain in quarantine so that we can begin communicating this out to try and ease people's nerves?
Okay.
And try to get ahead of a panic is what I'm
Sure,
looking for.
sure. And like Doug said, we're learning new things all the time. Initially, people were quarantined at home if they had a positive test until they had 2 negative tests 24 hours apart. Now, obviously, that would have eaten up our testing supply, and they found that that wasn't actually best practices anyway. So now there is additional guidance that's out there. If somebody has a positive test, they are quarantined at home. Okay, so their movement is limited. They are not to go out to the grocery store. They are not to go out and refill prescriptions, those sorts of things. It depends, each individual is going to be a little bit different. It depends on symptoms. So once their symptoms go away, there's a period of time that they are showing us where somebody is not considered infectious anymore. So again, it depends on when their symptoms are gone, and public health is working with physicians' offices and the patients to figure out when that is and start the clock and let them out of quarantine or isolation at that point. If they're symptomatic and positive, they would be in isolation, not quarantine. So people are getting out possibly a little bit sooner because the evidence is showing we don't have to keep them necessarily home as long as we thought. So they will, a person who tests positive will receive those test results, will get instructions on isolation, and will know when they are able to leave their property and go back to their normal lives.
Okay, thank you.
Thank you, Supervisor Lenz. And I'm happy to say I actually did get that guidance a little bit before 5:30.
No,
So
but I got it at 5:30.
read it once, but still need to digest it a couple more times. So thank you. All right, next speaker, Supervisor Albrecht, followed by Supervisor Powers.
Well, you answered some of my question, but so now somebody's checked it positive. Is that residents quarantined also? Years ago, they used to put a sign in their front window that somebody had an infectious disease and on each door. Is that done again like that now?
So it really will depend on the need for medical care. If someone is confirmed and has a mild illness and they can ride it out at home, they will. We don't typically placard residences unless there's some reason to believe that they're a risk to the public, in which case then we'd probably be making other arrangements or institute a quarantine guard or something like that. So it really is going to be, excuse me, case specific. Most quarantine and isolation is voluntary unless we have to order it because of a non-compliant individual that's putting the community at risk.
Thank you, Supervisor Albrecht. Next speaker, Supervisor Powers, followed by Supervisor Gordon.
Thank you, Mr. Chairman. Was just asked actually on Sunday for one of my constituents, what should protocol be for people who are living in multifamily units, like people who live in condos and apartments, and they find that a neighbor in that building is supposed to self-isolate? Thank you.
At this time, that would be fine. I mean, there's no additional risk to somebody who is living in like a multi-apartment building. When somebody has either tested positive or is waiting for their test results, they are educated on making sure that they're not hanging out in any common spaces. For example, if an apartment building had social activities or perhaps a pool or a gym or something like that, they would be advised not to be in those facilities anyway. So
What about just a common hallway?
common hallway's fine.
Okay.
You know, there is no known risk for walking by somebody and passing this off that easily.
Okay, thank you.
I just want to add to that.
Please.
Same with, self-quarantine. People can be at home with their family members too. I mean, they are given specific instructions about isolating themselves from, and I probably shouldn't use that term when we're talking quarantine and isolation, but they are instructed to keep distance from the rest of their family. Because when we're only suspecting that they were exposed to a disease, and we don't really know if they're going to develop disease, and so really until they have symptoms, we just urge them to stay home, or get through that that incubation period, and then keep distance at home from family members. Not share the same bedroom, that sort of thing.
Thank you, Supervisor Powers. Next speaker, Supervisor Gordon, followed by Supervisor Defferting.
Thank you, Mr. Chairman. So, Kim, you said that there were 2 labs that were running tests currently, one in Milwaukee and one in Madison. Are there plans to run all of these millions of tests that the federal government has promised will come out? Are there plans to expand labs who will be running the tests?
So there are 2 public health laboratories. Those are the ones that I'm speaking of, the Milwaukee State Public Health Lab and the Wisconsin State Lab of Hygiene that are running tests. And they are running the majority of our health system tests now. There are also, 4 labs? 4 or 5 commercial labs that are coming online with being able to do tests as well. But as the last count, when we talked to the healthcare systems, they were still using the Wisconsin State Lab of Hygiene. So that's why I referenced that lab.
Okay, but the amount of tests that will be able to be run will be able to be increased then?
Exactly. The more labs that come online, the greater the ability to do tests.
Okay, thank you.
Thank you, Supervisor Gordon. Next speaker, Supervisor Defferting.
Supervisor Gordon stole my question.
Thank you, Supervisor Defferting. Seeing no other questions, we'll go ahead and conclude that portion. Thank you both for your information and for being here. Okay, so moving on down, we have no zoning reports and ordinances, so we'll go straight to resolutions. And we'll start with the first one. That's resolution number 283-032020. Commendation for Sandra Starkle. I'll call on Supervisor Rasmussen.
Thank you, Mr. Chairman. I move for resolution 283-03-2020.
There's a motion and a second. Please proceed.
Sandy Starkle began working for Winnebago County in April 1985, starting at the mental health clinic in Neenah. In 1991, she transferred to the clerk of court's office. As a dedicated clerk of courts employee, Sandy Starkle was well known for her kindness and humor. She took on different positions during her time with the clerk of court's office, ranging from a small claims clerk and court assistant roles in Circuit Court Branch 2 and 5 to her most recent position as Family Court Commissioner Krieger's court assistant. We thank Sandy for her nearly 35 years of dedicated service to the county. She will be missed.
Thank you, Supervisor Rasmussen. There was a motion and a second to approve the commendation for Sandra Starkle. We'll do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. Moving on down to the next resolution, top of page 2. That's resolution number 284-032020. Commendation for Deborah Klemps. I'll once again call on Supervisor Rasmussen.
Resolution 284-03-2020.
Second. There's a motion and a second to approve resolution number 284-03-2020. Please go ahead, Supervisor Rasmussen.
Deborah Clems began her career with Winnebago County Human Services as a med tech with behavioral health, providing direct services to consumers. She served her clients with compassion, respect, dignity, and always a little humor. In July 2002, she came to the Economic Support Division and began 18 years of providing eligibility service to our Badger Care, Food Share, and Wisconsin Shares clients. Deb provided quality customer service to many people on the phone and in person. Deb always managed to keep a positive attitude. She was an especially supportive coworker for her teammates and particularly liked to share her love and knowledge of animals. After 20 years with Winnebago County, Deb retired on February 28, 2020, and is looking forward to spending more time with her animals and traveling.
Thank you, Supervisor Rasmussen. There was a motion and a second to approve the commendation for Deborah Klemps. We'll do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. Moving on down to the next resolution. That's resolution number 285-03-2020. Authorize the design phase of a capital project for Parkview Health Center's new ancillary building to serve as a garage, storage space, and training facility at a cost of $50,000 to be funded by Parkview Health Center's unrestricted fund balance. For that, I'll call on Supervisor Ellis.
Thank you. Is it on? No. I can talk about it.
Please go ahead, we'll try it.
I move to the floor, Resolution 285-032020. Second.
There's a motion and a second to approve resolution number 285-03-2020.
And if there's any questions, Marlia's is administrative for Parkview's in the back, if you've got any questions.
Thank you, Supervisor Ellis. I see one calling. I'll call on Supervisor Eisen.
Thank you, Mr. Chairman. I would like to ask the board to perfect this resolution. And what I mean by perfecting it is to include at line 18 the total cost of construction for this facility. The $50,000 is for the design phase, but there is no reference whatsoever to the full cost, the $250,000 cost of the project. I would submit that in the form of a motion, looking for a second, and perhaps asking the director to explain that, or to explain perhaps why it shouldn't be there.
Thank you, Supervisor Eisen. But Jett, I'll call on our Finance Director, Vicki Fitzgerald. Yeah, actually, was there a second? That's a good point. There was a motion and a second. Thank you.
Okay.
Please.
At this time, we're only asking for the design funds, so that is why we're only asking for $50,000 to come out of their undesignated fund balance for Parkview. That's usually how we write these up. I mean, we could put something on here what we're estimating total cost to be, but we're only asking for the $50,000 right now.
I understand that, but I think it's far more illustrative to let both the supervisors and the public know that this is a $250,000 project, even though we're only asking for the $50,000 to get it started.
I'd have to consult with Director Elder and Beck. I believe it's more than $250,000. I believe it's $500,000 or $550,000. $500,000 altogether, $50,000 of that being design.
That's even more reason why it should be included in there. Otherwise, what's $50,000 for a garage?
Thank you, Supervisor Eisen. So there was a second to that, so that is currently the motion on the table, the amendment. I'm going to go ahead and word this for you because we do have to discuss this and vote it up or down. So what I think you were saying was in line 18, it would say another whereas the estimated cost of the project is $500,000. That would be the line 18.
Whatever the amount would be.
Very good. Because we do need, if we're going to debate an amendment, we need to have some actual language.
Correct.
So that would be the language we'd be discussing. And there was a second, correct? Vice Chairperson Egan. So that, the debate is on the amendment first, and then once that is voted up or down, we'll move to the main motion. So for that, I'll call on Supervisor Norton specifically on the amendment to add that language. No. Okay. Seeing no other call-ins then, we're gonna go ahead and try I apologize, Supervisor Winger, please go ahead.
Thank you, Mr. Chairman. We built a new jail. We didn't do this. We built the Parkview Health Center. We didn't do this. We built many things. We didn't do this. Why would you want to change the rules in the middle of the game? We've had this presentation, I thought very good presentation, showing the need, and most importantly, showing that the money wasn't coming out of, was coming out of funds that have been already set aside for these kinds of things. Also, how are you going to know what the cost of the project is until you have this kind of study done? You aren't going to know. You're just guessing. So it is a very prudent thing to go ahead at this point to design the facility at the cost of $50,000 and then, proceed from there. This is the way we've always done it. I have no idea why we would change this now. There's no good reason for that at all.
Thank you, Supervisor Wingren. Next speaker, Vice Chairperson Egan.
Thank you, Mr. Chairman. I seconded that motion myself, and not because I actually wanted it that way. I wanted our financial director to explain what it was, and so that's why I did it that way. I agree with Supervisor Wingren. We've never done it that way. This is just here for the design and that and how much it will cost. We don't know if it's going to be $500,000 or $1 million or if it's going to be $200,000 until we do the design and what we want. Thank you.
Thank you, Vice Chairperson Egan. Seeing no other call-ins, just for clarification, and then we're going to do a voice vote, but the amendment is, whereas the estimated cost of the project is $500,000, that would be added line 18. Okay? If you're in favor of adding that, say aye. Aye. Opposed? No. So that motion fails. So we're back on the main motion. Is there any discussion on the main motion? Seeing none, we're going to go ahead and do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. Moving on down to the next resolution. That's resolution number 286-03-2020. Authorize the Winnebago County Highway Department to accept $830,000 from the Wisconsin Department of Transportation for additional work completed in fiscal year 2019 and appropriate the funds to other operating expenditure category. For that, I'll call on Supervisor Albrecht.
Didn't come on, but anyways, I'll move for adoption of resolution 286-03-2020.
There's a motion and a second to approve resolution number 286-03-2020. Any discussion? Seeing none, we'll once again do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. Thank you, Supervisor Albrecht. We'll move on to the next resolution. It's resolution number 287-03-2020. Authorize execution of an airport lease between Janney G Aviation Incorporated and Winnebago County. For that, I'll call on Supervisor Gabbard.
Resolution 287-03-2020.
There's a motion and a second to approve resolution number 287-03-2020. Any discussion? I'll call on Supervisor Nussbaum.
Thank you, Mr. Chairman. I see that the standard insurance clause is in there, but it seems like they should have more insurance to me. It just doesn't seem like there's enough insurance on something like this. You could have a fuel spill or a crash or...
Thank you, Supervisor Nussbaum. Corporation Counsel, I don't know if you can add any clarification for him?
Yes, I can. Typically, our insurance department, specifically Doug Petrazik, looks at these. And normally, he would see say if there was a problem or not, and then if he says it, I call our carrier. I look at a lot of leases. I don't have a specific recollection. So all I could say is if there were a problem, I think I would have made a call to our carrier.
But somebody looked at it, right?
Yeah, and I'm looking at Vicki Fitzgerald because Doug is under her.
Sure. Yes, we work with the airport on all of their different tenants, and we have the same coverage that they're required to have, so
right.
Doug does look at that
Thank
and
you.
works with insurance companies.
Thank you, Corporation Counsel. Thank you, Director Fitzgerald, and thank you, Supervisor Nussbaum. Okay, seeing no other call-ins, we'll go ahead and do a voice vote. All those in favor of resolution number 287-03-2020, say aye. Aye. Opposed? Motion carries unanimously. Moving on down to the next resolution. That's resolution number 288-03-2020. Authorize Winnebago County to renew a 5-year agreement with Winnefox to participate in a federated public library system pursuant to 43.15, parent 4, parent B, Wisconsin statutes. For that, I'll call on Supervisor Powers.
Powers?
That's correct.
I move this number 288-03-2020.
There's a motion to a second to approve resolution number 288-03-2020. Any discussion? All right, we'll once again do a voice vote. All those in favor say aye.
Aye.
Opposed? With one abstention for Supervisor Eisen, the motion carries. Thank you, Supervisor Powers. Once again, one of those rare opportunities that it's good that I had the third person on deck, so to speak, just in case for these moments. All right, moving on down to resolution number 289-03-2020. Authorize a 3-year rental agreement between Winnebago County and the Oshkosh Hmong Service Center to hold its annual New Year celebration event at the Sunnyview Exposition Center. For that, I'll call on Supervisor Konecki.
Thank you, Mr. Chairman. I move for approval resolution 289-03-2020.
There's a motion and a second to approve resolution number 289-03-2020. Any discussion? Seeing none, we'll once again do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. Moving on down to the next resolution. That's resolution number 290-03-2020. Request authority to apply for funds for maintenance of county-owned and leased snowmobile trails and trail bridge building and repair. For that, I'll once again call on Supervisor Konecki.
Thank you, Mr. Chairman. I move for the approval of resolution 290-03-2020.
There's a motion and there's a second to approve resolution number 290-03-2020. Any discussion? Seeing none, we'll once again do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. So moving on down to the next resolution. That's resolution number 291-03-2020. Establish salaries for elected officials of Winnebago County. For that, I'll call on Supervisor Rasmussen.
Thank you, Mr. Chairman. I move for resolution number 291-03-2020.
There's a motion and a second to approve resolution number 291-03-2020. Any discussion? I'll first call on Supervisor Gordon, followed by Supervisor Eisen. Please go ahead.
My question is, I'm all for this resolution, however, I'm wondering, are we also considering increasing the pay for the rest of the county employees on this kind of level?
I'll call on Director Collard. I know that, and he can answer, but the reason this is because it's time sensitive, because individuals have to take out nomination papers before April 15th for these. But please, Director Collard.
Yes, there are two independent procedures for setting salaries for elected officials compared with our compensation system for other employees. For elected officials, there are 4-year terms, and we are required, as the county board is required, I should say, to determine compensation for those elected officials before the start date for taking out nomination papers for the upcoming term. So that's April 15th with respect to these 3 officers. So they need to be set now for the entire 4-year term. So it's very hard to tie that kind of a forward-thinking system for a 4-year term to the same compensation we pay, our compensation system for other employees where we're just doing 1 year at a time. So in other words, we could tie somehow that compensation to what we've paid in increases to general employees, but then we would have to do it by looking back 4 years and then taking that percentage and applying it forward. There could be that's a 9-year period actually because of the current year. So there could actually be, quite a substantial lag, and there could be quite a different economy, over 8-9 years. So we aren't doing that. We're basically guessing in terms of the percentage increases. It's also very difficult to compare the 2 systems in that our increases for general employees are primarily merit-based. Performance evaluation, merit, those are the raises people get for the most part, with a few exceptions. So when you have an elected office, the compensation has to be set no matter who wins the election, so it can't be based on their performance, on their rating. You may say this elected official does a great job, she should get a big raise. We don't know that she will win the election, and we can't take back the big raise. So that's really a conundrum, and it kind of violates most compensation principles to do it the way we do, but we're forced to do it that way by statute. So we have to set it at a level that will keep good candidates, but also at a level that would be equally applicable for someone doing it for 30 years and someone just starting it. So, and especially when you look at across-the-board raises, we don't really have across-the-board raises anymore for most employees. What we have is, we have merit pay, which has been averaging about 2.5% per employee for those employees who are eligible. You have to be here a certain number of months to be eligible. But that merit pay has really kind of 2 components, or it replaces 2 things. It replaces across-the-board increases, which might be inflationary, and it replaces what you might call steps, or increases that would go to reflect the increased productivity that comes with experience. Is how you'd look at it. So I know it's a complicated answer, probably more than you're looking for. So there are 2 very different systems. We kind of want to look more at we don't do across-the-board raises, but we do make increases to the minimums and maximums of our compensation schedule. Those have been running at only 1 or 1.5% the last several years, but our merit raises have been higher than that, on the order of 2.5%. So the amount stated in the resolution is kind of a compromise between those 2, because there are some elements of both that should come into it, but it's really primarily based at looking at a small group of comparable counties about the same size and making sure we kind of keep up with them.
Thank you. It's just that I know it's important that we attract the best to want to run for these offices, but I wouldn't want any kind of resentment to be building among people that, wow, look how much these people are getting, and we're doing, we're working for them.
I don't think we're in that situation, so okay. I think we're good.
Thank you, Supervisor Gordon. Next speaker, Supervisor Eisen.
Thank you, Mr. Chairman. Mr. Collard, you touched on the idea of looking at other counties. How were these amounts determined to offer the next elected constitutional officers?
Yeah. We use the same, first of all, I looked at what they're currently paying in a fairly short group of counties, which is the same group we've been using consistently for about 5 years now.
What is the current pay for those positions?
All 3 positions are paid the same and have been for the past 4 years. Our current pay is $77,120 per year.
And how does that compare to Outagamie County?
Outagamie County is paying $73,960. They're fairly low. Oh, I'm sorry. Their county clerk is paid differently from the others. So their county clerk is paid less by about $3,500, and the Treasurer and Register of Deeds only very slightly less than ours.
Well, what did you determine in searching the national pool of constitutional officer comparables
Well, just looking
on
at
the
our
marketplace?
I'm sorry. Just looking at our comparable group of 7 other counties that are roughly our same size or in the same group, the average pay in 2020 was $79,000. So that's why I recommended $79,000 for the county clerk, $78,000 for the county treasurer, and $77,000 for the Register of Deeds. Some counties treat them differently. So wanting to keep ours the same, I took the average. We were on average, if we average all 3 positions, our pay would be $1,086 in 2020, below the average of those control group counties. And so that's why I recommended a one-time boost of $1,000 to the position to put us very close to that average. Then the percentage increase each year is kind of a difficult to estimate, but we were looking at 1.5%, but the P&F committee wanted to put it at 2%, which I thought was a very reasonable estimate as well, and within the range of what other counties might do the next 4 years.
It sounds very logical to me, but I know from dealing with all 3 of these constitutional officers that they're worth a lot more than that.
Thank you. Thank you, Supervisor Eisen. And thank you, Director Collard. Next speaker, Supervisor Albrecht, followed by Supervisor Lautenschlager.
Well, I was going to comment because I thought he was going to give it a jab that they were getting too much money, but technically, the job descriptions are altogether different, and they have different type of help up there and more assistance and different things like that. I agree with them on that part, though. They do deserve more money than what they're getting.
Thank you, Supervisor Albrecht. Next speaker, Supervisor Lautenschlager.
Thank you, Mr. Chair. I'm not disputing the increase at all, but I just want to clarify. So over the 4 years, it's 9.32%. Is that what you're saying, increase? Over the 4 years, 2.22 and 3 point. Yes. So, okay. So 9.32 over the 4 years. All right, just want to get that clarified.
Thank you, Supervisor Lautenschlager. I see one other call, and Supervisor Eisen.
Thank you, Mr. Chairman. I'm going to put my my voice where my thoughts are, and I would like to raise that 2021 salary to $80,682 for the 3 constitutional officers, and then an appropriate increase for the subsequent years. Because I think that you can be the average, you could be the median, but I like to think of Winnebago County as above the median and above the average. And I think our constitutional officers deserve that extra vacation.
Okay, so there's a motion and a second to approve an adjustment to the annual salary. And so what I would see is line, and the Budget Director, please correct me if I'm wrong, Budget 21, 22, and 23, all 3 numbers would change to $80,682. The only clarification I have is whether or not your motion was to carry forward that 1,000 for each subsequent year, or if it was the percentage as outlined. I guess I'll call on Finance Director Fitzgerald.
Yeah, I guess we need clarification. If we up it by that $1,000 in 2021, then are we taking the 2% on each one of those? Is that what you're proposing?
Yes.
Okay.
So she'll have to calculate those numbers here, because it'll be a little different than, of course, the 1,000 carryover, because it's 2% of that increase as well.
That'll also serve as an incentive for them to run again and provide the same kind of service.
Okay, so we did have a motion and a second, and I know that Director Fitzgerald is crunching the numbers, but in the meantime, we'll open it up for discussion. I see Supervisor Rasmussen, followed by Supervisor Norton. Please go ahead.
Thank you, Mr. Chairman. While I agree that we have some outstanding people, especially in these positions, and one of them in this room right now, that deserve more, please keep in mind that an election can change this. That's why these numbers are hard to come up with, because it's not merit pay. One of these people could get run against. You could have someone get in this position that has absolutely no experience in it, but because they won an election, a popularity contest, they could have that. So be careful on how much you raise it based on the great people that we have in it, because that can come back to haunt you. And I wish it was a different system. I wish these positions were not elected. I wish they were appointed so we could pay them merit, but we can't. Thank you.
Thank you, Supervisor Rasmussen. And before we go on to the next speaker, I'll call on our Finance Director to provide the numbers.
I believe Mike Collard, our Director Collard back there wants to speak first.
Please, go right ahead.
Numbers, I don't know if you have them. I was.
Well, do you have the fiscal note to go with it too, with a fringe versus wage?
Just the wage.
Yeah, okay, because
Yeah.
we could fix the fiscal note later, correct?
Right, but
Yeah.
the motion should include the numbers to go in the body of the
Right.
amendment. shouldn't it?
Correct.
Right.
So if we have the numbers, why don't we go ahead and give the numbers?
Go ahead if you
So
want.
the salary for 20, and you can check me and see if I'm right. It's always good to have multiple eyes on these, but I have the 2021 salary under the motion would be 80,682. In 2022, the salary would be 82,296. In 2023, the salary would be 83,942. And in 2024, the salaries would be 85,621 for all three, each of the three positions, of course.
Okay,
I concur.
very good. So each of those numbers, based on the amendment, would be in lines 21, 22, and 23 in their respective columns. So that's the amendment we're debating at this time. Okay, and with that, I'll call on Supervisor Norton, followed by Supervisor Buck.
Thank you, Mr. Chairman. About a decade or so ago, I was told by one of these officers that the deputies in their department was almost making as much as them. Can you tell me, Mike, is there a big difference between the register of deeds, who gets elected, and the deputy? Is there a big difference? That's one question I'm asking.
No, I don't have everyone's salary memorized, so I'm afraid I didn't bring the exact salaries with you. But the deputies in each office are in different grades in our compensation plan, and I'm confident there's a substantial difference in pay between each of the deputies and the elected officials.
Okay, very good. Thank you, Supervisor Norton. Next speaker, Supervisor Buck, followed by Vice Chairperson Egan.
Thank you, Mr. Chairman. I agree with a lot of what Mr. Eisen had said about retaining good help to Winnebago County. I feel that that's our most valuable asset is our folks that work here. I would just ask for the same consideration when we're talking about the snowplow drivers, the crisis workers, the CNAs, and that kind of stuff. And we really look back into the consideration of a 9.32 raise over 4 years, and the folks that are out there doing the work as well are in that kind of consideration. Thank you.
Thank you, Supervisor Supervisor Buck. Next speaker, Vice Chairperson Egan.
Thank you, Mr. Chairman. I was going to echo the same thing that Supervisor Buck said. Sometimes I think we get to the, these people are all great that we work for, every one of us. I think that who's ever worked with them knows that. But don't forget about the other people out in the field and that too. It seems like we pay them just pennies to get by, and sometimes I think, I don't know who's all making all the decisions, whether it's the foremans or who they are, but sometimes I don't think we're paying some of them out there enough either. So let's keep that in the back of our mind when it comes time for that also. Thank you.
Thank you, Vice Chairperson Egan. Next speaker, Supervisor Binder, followed by Supervisor Albrecht.
You know, I agree. I'd like to pay them a lot more, but, you know, we just hired an assistant for corporate counsel, and I believe that they get around $72,000, and that's an 8-year degree. You know, so you went to school for 8 years to be an attorney, and you can get this elected position. Any one of us can run for that, and we have no knowledge, and you can get that salary. So I think that we need to keep it where it was, and basically, we have good people, and I'm grateful for it, but there's a lot of people in this county that deserve more money, but unfortunately, our taxpayers only have so much money to pay. So we have to make do with what we have, and I'm grateful that we have the people that we have in the offices, but there's no more money to give them.
Thank you, Supervisor Binder. Next speaker, Supervisor Albrecht.
I think you have to compare it to the average department head. I think they make about 20 grand a year more than elected officials.
Thank you, Supervisor Albrecht. All right, seeing no other call-ins, given the Supervisor Eisen, Supervisor Eisen, I was already gonna, you took the words right out of my mouth. Given the discussion, I think we'll do a roll call vote, and also given Supervisor Eisen's request. So, vote aye if you approve the amendment, and that would be in lines 21, 22, 23, the column would be 80,682. In line 2022, it'd be 82,296. In 2023, for all three, it'd be 83,942. And for 2024, it'd be 85,621. The fiscal notes would be calculated later accordingly. So vote aye if you approve of that amendment, vote no if you don't. A simple majority would approve of it. And that motion passes 15-12. All right, so we are now on the main motion as amended. Any other discussion on the main motion as amended? Okay, seeing none, we'll attempt a voice vote. All those in favor say aye. Aye. Opposed? Motion carries. All right, so moving on down to the next resolution, and that starts at the top of the third page. So that's resolution number 292-03-2020. Amend the table of organization for Parkview Health Center to remove part-time housekeeping supervision position and add full-time environmental services supervisor position. For that, I'll call on Supervisor Rasmussen.
Thank you, Mr. Chairman. I move for resolution number 292-03-2020.
There's a motion to approve resolution number 292-03-2020. I heard a second. All right. Any discussion? Seeing none, we'll do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. Moving on down to the next resolution. That's resolution number 293-03-2020. Amend the table of organization for the Winnebago County Department of Human Services by eliminating one full-time crisis intervention manager and adding one full-time mental health crisis specialist lead position. I'll once again call on Supervisor Rasmussen.
Thank you. I move for resolution number 293-03-2020. Second.
There's a motion and a second to approve resolution number 293-03-2020. Any discussion? Seeing none, we'll once again do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. Moving on down to the next resolution. It's resolution number 294-03-2020. Authorize the Public Health Department to accept a lead abatement grant from the Wisconsin Department of Health Services in the amount of $600,331 and appropriate the funds to program expenses. For that, I'll call on Supervisor Norton.
I move for adoption of resolution 294-03-2020.
There's a motion and a second to approve resolution number 294-03-2020. Any discussion? Seeing none, we'll once again do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. Moving on down to the next resolution. That's resolution number 295-03-2020. Amend the table of organization for the Public Health Department by adding one full-time lead abatement project coordinator position. I'll once again call on Supervisor Norton.
I make a motion to move resolution 295-03-2020.
There's a motion and a second to approve resolution number 295-03-2020. Any discussion? Seeing none, we'll once again do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries. Next resolution, it's actually ordinance. Ordinance number 296-03-2020. Amend section 11.11 of the General Code of Winnebago County, amend Appendix A, Winnebago County Public Health Department, 2020 to 2021 permit fee schedule. I'll once again call on Supervisor Norton.
Make a motion to move resolution 296-03-2020.
Is there a second? Second. Motion and a second to approve ordinance number 296-03-2020. Any discussion? Seeing none, we'll once again do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. Moving on down to the next item, that's ordinance number 297-03-2020. Amend section 13.09 of the General Code of Winnebago County. For that, I'll call on Supervisor Bender.
I'll move ordinance number 297-03-2020.
There's a motion and a second to approve ordinance number 297-03-2020. Any discussion? Seeing none, we'll once again do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. Moving on down to the next resolution. It's resolution number 298-03-2020. Adopt a new general fund balance policy for Winnebago County. For that, I'll call on Supervisor Rasmussen.
Thank you, Mr. Chairman. Before we make the motion, just to note on page 3, the last line, there is a typo. The word biannually should be biennial, that's it. They're close to the same word, but they're not.
Okay, so biennial should be biennial. I'm struggling to, page.
The last.
Yes, I see it. Very good. Last line, it should be biennial. Thank you for that clarification, please.
With that, I'll make the motion for resolution number 298-03-2020.
There's a motion. Please go ahead.
Just like to add that Winnebago County does not have a formal policy for then designated general fund balance. This resolution will formalize a policy for Winnebago County to set guidelines for appropriate levels of undesignated general fund balance. It was based on best practices set forth by the Governmental Financial Officers Association. And I'd like to thank Supervisor Singstock for driving this policy and working with Finance Director Fitzgerald to make this happen. Thank you.
Thank you, Supervisor Rasmussen. There was a motion and a second. Any discussion? Seeing none, we'll do a voice vote. I apologize. Came in. There you go. Please go ahead, Supervisor Eisen.
Thank you very much, Mr. Chairman. Could I call upon the Financial Director to explain to the board what the policy is?
Absolutely.
And how it's determined?
I'll call on Finance Director Fitzgerald.
My pleasure. So what I did is I went out and I did a few different things. There was a survey of the Wisconsin counties, and of the 72 counties, 29 of them responded. And most of them had a lower limit and a higher limit that they would keep their fund balance, the undesignated general fund balance between. And the lower limit was in some counties as low as 10%, and the upper limit in some counties were as high as 40%. So it was a big 10 to 40% range. What I did is we have an association as government financial officers that we follow and go to the different association meetings. It's Government Financial Association, Officers Association. And I went to their best practices. They do a lot of best practices for us in the government field. And they recommend, at a minimum, that general purpose governments, regardless of their size, maintain unrestricted budgetary fund balances of no less than 2 months of regular fund operating revenues or expenditures. Most of the counties in Wisconsin use expenditures, so that's why I chose expenditures. And 2 months would be about 16.67%, and 2.5 months is about 20% of reserves. So with that being said, then I went to I put a template together after looking at many different policies, and I started out with what is our purpose of even having a policy. And again, we had no formal policy before this. And what I really wanted to do is what a fund balance does is measures our economic stability, and it helps protect our credit worthiness, and it helps just mitigate any financial risk for us when we do have unforeseen revenue fluctuations or unanticipated expenditures, which in our day and age right now with COVID-19, there could be expenditures that we're expected to pay more sick pay. Those are those type of unexpected expenditures that we can't even foresee. So just wanted to put that out there of where we are right now. With that, I defined in this policy different things of what a fund balance is. We have to actually have 5 components of a fund balance ever since our Government Accounting Standards Board put in a standard for that. When it gets down to it, then anything that's not restricted or signed or committed for other purposes is our unrestricted fund balance, or that we call the undesignated fund balance. And with that, then we looked, and I had a couple meetings with PNF, so we did discuss this very thoroughly in PNF as well, to get their direction. And again, Harold and I sat down a lot on this as well, because he's very familiar with the fund balance. And we came up with that our basic goal is to stay within a targeted range. And what we decided was 16 to 20%, which is 2 to 2.5 months worth of reserves. And what we're going to do is use the subsequent year's budgeted expenditures. And I'm only looking at the general fund expenditures and human services, because human services is levy supported by us, and their whole fund balance rolls into the undesignated general fund balance. They have no fund balance to themselves. So when I look at that, the expenditures are about $111.5 million. So if I was going to say we should have 16% at the lowest range for our general fund balance, it would be about 17.8 million. 20% would be about 22.3 million. So I feel like we should be in between the 17.8 to the 22.3. So what this policy says is anything above that, the highest part of the range, above the 20%, we are going to take at least 1/2 of that excess and appropriate it to lower the amount of bonding for capital projects in future years. So if I did, for instance, if I had an excess over the maximum of $4 million, at least $2 million of that would go towards the bonding. The other portions would be available for us to use for the one-time capital projects or one-time expenditures that we don't expect, the unanticipated lack of revenues if the state would come and even limit us further on levies and so forth. And this way, I have some guidance, because right now, our informal policy was saying that we should only have 1 month of reserve on hand, which was way too low per government standards. And even the auditors even said 25% they recommended, but I'm being more conservative with what the GFOA said. So with that being said, now I will have guidance to watch that and keep going to lower it and lower it until we stay within that range. But then in policy, we also talk about what if it falls below the minimum range, which that can happen. We've been very lucky to have a very healthy fund balance. If that happens, then we would come up with a plan that we would develop in the whole budget process of how, what programs would we have to cut, or what are we going to cut to get our fund balance back up to where at the minimum at least. So we looked at that. And then the third page where I did say, where I had the word wrong, we will every other year review this as well to see if there's any updates needed, and I'll review it with PNF. So we don't just put this on the shelf and not make sure it's still relevant and being followed. Does that help, Supervisor Eisen?
Yes, but you've raised the question of what's more important, to fund the projects that we're working on or to keep the fund balance. The fund balance is there because it's left over from what we didn't use for that projected year. So it raises a question about that maximum amount.
Well, if I may, we are well over that maximum, and I want to start using that to not bond, and that will keep our borrowings even and to go down.
Okay.
So we wouldn't be borrowing more. I could not borrow
Well,
that much.
what I'm perhaps referring to is the minimum.
Mm-hmm.
You mentioned that we'll solve the minimum problem when it comes up.
Sure.
Ought it be lowered from that amount? Because I wouldn't want to see something not funded simply because we want to maintain a fund balance.
We would at least have to bring it to the board and have the approval then to go below the minimum, because we do want a policy that we,
Okay, that's just like asking for 3/4 vote because we're going above the levy guides.
Right.
Thank you.
you're welcome, thank you.
Thank you, Director Fitzgerald, and thank you, Supervisor Eisen. Next speaker is Supervisor Powers, followed by Supervisor Binder.
Thank you, Mr. Chairman. I wish Dr. Topol hadn't left after that last vote. We mentioned human services. A couple of extra kiddos needing secure detention beds, or a couple of more adults needing behavioral health beds could really throw a current budget for human services really out of whack. And the state sometimes doesn't reimburse for maybe 2 years after a service has been rendered, and it's based on some kind of sliding scale that no one understands, and then we are told, don't ask how you're getting this money, because you may not get it if you keep asking. It's not a good system. It's what we're stuck with. But if we're going to start limiting, I mean, human services is always when they have the money, they turn it back in. But we can't always know when there's going to be an emergency that we need beds for kids in secure detention, or adults, or kids in behavioral health, behavioral health situations. I'm not quite, when you mentioned behavioral health, human services, so, the lights went on quickly. I'm concerned about what this is going to do to human services.
Please go ahead, Director Fitzgerald.
And what I meant by that is I'm using their full expenditures to make sure we have enough reserve on hand if something were to happen, because they don't care. They're a special revenue fund in governmental accounting, which means they just are part of our general fund. So their fund balance is our fund balance with general fund. So that's why I do take into the account what their expenditures are when I decide how much I need in the reserve. So in my tenure here so far, they have had those windfalls from previous years from the state where we're getting reimbursed for previous years. So they have had quite a large surplus each year.
Which they turn back.
Which they turn back. But that again is why we have that sitting in the general fund. So if it turns around, then we have to look at that and know that we'd have to use some of that towards them, and we're aware of that. But they're intermingled with the general fund because they're a special revenue fund.
So you're telling me this will not impact, should we need additional beds for secure detention or behavioral health issues with the population, that this fund balance that we're discussing and possibly making a decision on, we're not going to come up short in human services?
They'd be part of the normal levy process, and if they need more levy because times have changed, we will look at that and then look at other areas where we can cut. But it's part of the big pie.
Okay, thank you.
Thank you, Director Fitzgerald. Thank you, Supervisor Powers. I'll call on Supervisor Binder.
Is it possible to use that surplus to pay off existing bonds with higher interest rates? I mean, interest rates now are at historical lows. So if we're not going to basically bond for our capital projects, we can get interest for next to nothing. I'm sure we got bonds out there that are 2-3%. Wouldn't it be better to use that money to pay off the high bonds and basically bond for our capital projects for this year?
Yes, and I was just having that conversation with my assistant finance director this week. I think the rates are going to get extremely low to borrow, so it would be not fiscally responsible for us not to, that we should borrow at that low rate and pay some of that off. So what I'm saying is this half that we use for bonding, I shouldn't even say just future bonding, but it goes into our debt service on how we choose to use that within the debt service, whether we bond less or pay off other bonds and bond at a much lower rate, which obviously in 2 weeks, I saw at least 150 basis points drop on all of our investments. So we're in a time where I'm going to really watch that.
Thanks.
Thank you. Good point.
Thank you, Supervisor Binder, and thank you, Director Fitzgerald, for your comments. Seeing no other call-ins, we'll go ahead into a vote. Once again, we'll do a voice vote, so that's for resolution number 29803-2020, adopt a new general fund balance policy for Winnebago County. We'll do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. Moving on down to the next resolution. That's resolution number 299-03-2020. Authorize Winnebago County to enter into a 2-year agreement with Municipal Services Bureau MSB, for credit/debit card e-check processing and merchant services. For that, I'll call on Supervisor Rasmussen.
Thank you, Mr. Chairman. I move for Resolution 29903-2020.
There's a motion and a second to approve Resolution number 299-03-2020. Any discussion? Seeing none, we'll do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. Moving on down to the next resolution. Last resolution on this, second to last resolution this evening. That's Resolution number 300-03-2020. Proclaim the week of April 6th to 12th, 2020 as National Public Health Week in Winnebago County. For that, I'll call on Supervisor Norton.
Make motion to adopt Resolution 300-03-2020.
There's a motion and a second to approve Resolution number 300-03-2020. Any discussion? Seeing none, we'll do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. Moving on to the final resolution this evening, that's Resolution number 301-03-2020. Proclaim the month of April 2020 as National County Government Month in Winnebago County. I'll once again call on Supervisor Norton. There's a motion and a second to approve Resolution number 301-03-2020.
I do want to speak on
Please,
this just one
go right
comment.
ahead.
You know, obviously, my hope is maybe next year at the same time before the county executive and whoever a county board chairman is devises a plan or something how we can educate the public on the various departments that we have. Obviously, if we done it this year, it probably wouldn't no good right now, but that's what one of my aim is, and I didn't get around to it till very late. So I hope the county executive is listening. I sent an email about it, and like I said, next year I hope that we have somehow each department find a way to educate the public on what we do.
Thank you, Supervisor Norton. Seeing no other call-ins, we'll go ahead and do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. So that concludes our business meeting for this evening. One last final thanks again to Supervisor Smith, Supervisor Wojciechowski, Supervisor Singstock. One final, if we can please give them a round of applause again for their service on this board in the county. And with that, I will call on Supervisor Albrecht for a motion to adjourn.
I move that we adjourn until our April 21st business meeting.
There's a motion and a second to approve until April 21st. All those in favor say aye. Aye. Opposed? We are adjourned. Thank you, everyone.